I want to talk about the grim milestone that America has reached, which is that between April 2020 and April 2021, 100,000 people have died from drug overdoses, over 100,000 people. And this figure should be startling, but it's hard to be surprised. The pandemic has exaggerated longstanding dynamics in the US, including those that fueled the opioid crisis. There are many reasons for this crisis, and they have been explored quite competently across the mainstream media. But one thing that often goes unanswered is why this crisis is worse than the US than in any other OECD nation. Why do we have the crisis that we have in America? What goes unmentioned is that America's for-profit healthcare system, weak regulations, and permissive lobbying make the US the perfect market for legal and illegal drug dealers alike. American capitalism created the conditions for these deaths. The Sacklers and countless others who profited off of this system simply found the most favorable market for their product. But it didn't have to be this way. Let's start with our for-profit healthcare system. In order for insurance companies to make money, they need to earn more in premiums than they pay for in medical services. The math is very simple. One way companies ensure this is to have a list of acceptable medications that don't need prior approval. These are medicines a doctor can prescribe from a list provided by the insurance company, knowing they will be completely covered. In 2017, ProPublica found that insurance companies, including Medicare, limited access to more expensive but less addictive pain medications while making cheaper generic opioids easier to prescribe. Quote, ProPublica and the Times analyzed Medicare prescription drug plans covering 35.7 million people in the second quarter of this year. Only 1/3 of the people covered, for example, had any access to Butrans, a pain-killing skin patch that contains a less risky opioid, buprenorphine. And every drug plan that covered lidocaine patches, which are not addictive but cost more than other generic pain drugs, required that patients get prior approval from the insurer for them. Moreover, we found that many plans make it easier to get opioids than medications to treat addiction, like Suboxone. Drug plans covering 33.6 million people include Suboxone, but 2/3 require prior authorization. And even if they do approve coverage, some insurance companies have set high out-of-pocket costs for Suboxone, rendering it unaffordable for many addicts, a number of pharmacists and doctors say. This is not unique to Medicare. ProPublica found that every insurance company forced patients and doctors to use cheaper, riskier treatments because it's better for their bottom line. Millions of people suffering from pain could benefit from less addictive medications or alternatives like physical therapy, but insurance companies continued to direct people to riskier, cheaper alternatives that could lead to long-term addiction and devastating consequences. Similarly, treating addiction is expensive, and insurance companies make it hard to access that care, so they aren't burdened with the cost. But states, rather than require that addiction treatment or opioid alternatives are fully covered by insurance, are appealing to the insurance companies directly to change these practices. 37 state attorney generals wrote an insurance company trade group in 2017 asking them to alter their policies so that more costly but safer treatments were covered. Not surprisingly, the companies did not do as they were asked. In 2017, Joe Manchin, notorious for his objections to the Biden infrastructure plan, penned a letter to the CEO of United Healthcare, urging them to alter their policies to make it easier for patients to get less addictive pain medication and affordable substance abuse treatment. Quote, I ask you to reduce or eliminate the barriers that your beneficiaries face to access non-opioid pain medications and physical therapy for pain management. Just as importantly, I urge you to ensure that every beneficiary that you serve that needs substance use disorder treatment, including behavioral health counseling, is able to afford it. Now, this has long been a concern for Manchin. Here he is in 2015 at a town hall discussing the opioid crisis.
To Brooke County now, where community leaders were joined by Senator Joe Manchin in an effort to tackle West Virginia's drug epidemic. Prescription drug abuse was the center at today's town hall meeting hosted by Senator Manchin. He discussed ways to stop this growing problem.
That starts with pharmaceuticals putting out drugs we don't need, FDA approving drugs on the market that shouldn't be approved, and doctors dispensing more than what needs to be dispensed.
No matter how bad
While there is no one specific cure, Senator Manchin also said the way addicts are treated needs to change in order to see an improvement.
After Manchin's 2017 letter, Anthem, another insurance giant, issued a statement in response. They said they shared the senator's concerns and were working to address the issue, but noted that some opioid alternatives cost between $350 and $1,500 per prescription. And here's where the rubber really meets the road with this issue. Manchin is probably genuinely concerned about the opioid crisis. He has been advocating for better care and treatment for years and continues to do so. West Virginia has one of the highest rates of opioid deaths in the country, and it's no doubt a huge concern among his constituents. But the math is simple. Insurance companies do not want to spend money on more expensive drugs while cheaper alternatives are available. And Manchin, for all his talk, doesn't want to lower drug prices and refuses to take on the pharmaceutical industry. He has blocked legislation to expand Medicare, which would allow more people to receive addiction treatment. And he's blocked legislation that would drive down the cost of prescription drugs. Lowering the price of opioid alternatives and drugs that are essential to treating addiction would change the arithmetic insurance companies are using and give people access to safer pain treatments. But Manchin and others refuse to alter the rules of the game. Instead, they have asked insurance companies and drug companies to volunteer to lose hundreds of millions in revenue out of the goodness of their hearts. This weakness isn't unique to Joe. The U.S. is the most profitable market for drug companies. The Sacklers knew this, and so do other manufacturers. They are literally banking on the permissiveness of U.S. law and weak political will to line their pockets.
Drug prices in the United States are much higher than anywhere else in the world, and the main contributors to that are the U.S. drug marketplace, which allows drug companies to charge whatever the market will bear, and then in many respects places limitations on payers' abilities to try to negotiate lower drug prices.
Drug companies stand to make more money here than in any other country. It is the perfect place to create a drug crisis. But it's not just the market conditions that make the U.S. appealing for drug companies. It's coupled with a permissive legal system that allows for drug companies to directly advertise to doctors and patients, something that is illegal in other countries, and exploit a revolving door of lobbyists and corporate-friendly politicians and push out unfriendly legislation with their disproportionate influence on our political system. The U.S. is exceptional in the ability for drug companies to use direct-to-consumer advertising. Here's a quote from the Harvard Health blog, quote, "Almost every country in the world bans DTC ads for health products like medications and procedures. Years ago in the U.S., drug ads were directed primarily at doctors. But in 1997, the FDA eased restrictions to allow pharmaceutical companies to advertise directly to consumers. With restraints lifted, spending on prescription drugs soared to more than $6 billion a year and rising. Do the ads work? Yes, indeed. Estimates suggest drug sales rise up by $4 for every dollar spent on advertising. At healthcare visits, up to a third of patients ask about a drug they've seen. These ads have been shown to increase the number of prescriptions written for those products. Does this actually improve patient health? That's far less clear. The Sacklers, like every other company, peddled their drugs directly to doctors and patients, creating demand for a product they deliberately misrepresented. And when a deadly product they knew was addictive started killing people en masse, the Sacklers did what countless companies before them have done. They exploited the weak consumer protections in the U.S. and ran a campaign to blame the victims. When legislation finally got made to address the crisis, they exploited a political system that favors powerful corporations over everyday people and blocked it at every turn. Here's an example from WBUR.
Purdue Pharma, the maker of the addictive pain-killing drug OxyContin, believed Beacon Hill lawmakers could make or break their profits. The state attorney general's ongoing lawsuit against Purdue and the family behind it, the Sacklers, give a window into how they allegedly manipulated legislation. Attorney General Maura Healey alleges the Sacklers and Purdue bragged about killing bills and writing a law to increase sales.
At that point, these kids were on this drug and they were dying.
That's former Senator Stephen Tolman, now president of the Massachusetts AFL-CIO. He also tried to restrict OxyContin, and his bill also went nowhere. He says Purdue had too much power.
When you have a lot of money, you can buy the lobbyists and you can convince people.
He recalls meetings with Purdue representatives who tried to convince him.
They used to come and they'd bring all their lawyers and they'd be cute and, oh, this is medically necessary, and they'd stand like they were saving people's lives, and the only people that were getting in trouble were those who were misusing it.
All this paved the way for cheaper and even more lethal alternatives to flood the market the Sacklers carved out. But the conditions for this crisis were not made by the Sacklers. They were simply exploited by them, in much the same way that every large company, from Facebook to McDonald's to Philip Morris, has done. This crisis was made by American neoliberalism and the degraded legal and political structures that accompany it. There are simple solutions to the opioid crisis, and there are more complex ones. The simple ones, lowering the cost of prescription drugs and opening medical care so all people have it for free, are being actively fought against by people like Joe Manchin, who talk a big game about addressing the roots of this crisis, but are too weak to take it on. We should be extremely clear here. People are dying because of the refusal of the political class to expand life-saving care. They are being left to suffer and die because politicians like Manchin are worried about an entitlement culture among regular people rather than actively addressing the corporate entitlement that led to this crisis. The entitlement that saw them pushing deadly drugs to people who had no hope of fighting back personally, politically, or legally. The more complex solutions are things the left has advocated for a while. Broad programs that combat deaths of despair, that revitalize the social safety net, and create a society that provides hope and community rather than dreary alienation. We need to change our legal and political systems so they actually serve working people and not corporate interests. But there is a grief and a loss we will all have to live with. Lives that can't be reclaimed from capitalism. Lives the corporate class felt entitled to end on their crusade for profit and domination.
That's really well put. And I think, again, goes back to what we were saying earlier about how, it's, again, the Sacklers are probably more culpable than like anybody else in America for generating and fueling the opioid crisis. But at the same time, if they didn't exist, somebody else would have come along and done exactly the same thing. Because the point is that it's the structures, the political and economic structures, that put everybody involved into the position that they're in.
Absolutely. If you looked at the US as a market, right, rather than thinking, do I care if people live or die? Mm-hmm. Shelf that. Think about, is this profitable for my product, or is this profitable for my bottom line? That's what they did. They used the cold logic of the market to generate sales for a product they made. They didn't think, we love, killing people and essentially burdening like local cities with horrifying, nightmarish conditions. They thought, we want to make a lot of money. And the US was the perfect place to do it. And that is the same logic that many other companies are using that are also dangerous or, create social ills.
If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.